In a world filled with busy schedules and endless distractions, taking charge of your health has never been more crucial. Welcome to a journey of empowerment, education, and well-being with Health Check with Dr. Nooristani.
Welcome to Health Check with Dr. Nooristani. 60 to 70 million people are affected by digestive disease every year, and with the cost of approximately $142 billion annually. The number of diseases that are included in digestive health are quite diverse, and they are all related to your gut health. Today, we are going to take you to a journey that could transform your health from the inside out with our special guest, Cecelia Catena, a clinical dietitian with a focus on gut health. We will dive into fascinating world of gut health backed by compelling statistics and also facts that underscores its significance. The gut microbiome plays an important role in human health and influences the development of chronic disease ranging from metabolic disease to gastrointestinal disorder and colorectal cancer. Of increasing prevalence in Western society, these conditions carry a high burden of care. Dietary pattern and environmental factors have a profound effect on shaping gut microbiome in real time. The gut microbiome has a direct relation to obesity and obesity-related metabolic disorders. Studies have indicated that the gastrointestinal microbiome can influence both sides of the energy balance equation, namely as a factor influencing energy utilization from the diet and as a factor that influences host gene that regulate energy expenditure and storage, so therefore leading to increased weight and conversion of some of those energy that is extra and not expanded to fat. The intestinal microbiome has recently been implicated in a host of other chronic disease ranging from inflammatory bowel disease like Crohn's and ulcerative colitis, type 2 diabetes and cardiovascular disease. Also, it's implicated in colorectal cancer. The community of roughly 200 prevalent bacteria, viruses, and fungi living in the human gastrointestinal tract provide a unique metabolic function to the host and are fundamentally important in health and diseases. Although genetic contribution play a role in our gut, data has revealed that environmental factors such as diet and household cohabitation greatly outweighs genetic contributions. Our gut is home to trillions of microorganisms, collectively known as the gut microbiome. The gut microbiome contains around 100 trillion microorganisms. It comprises over 1,000 different species of bacteria. Beyond digestion, the gut plays a pivotal role in our mental and emotional well-being through the gut-brain connection. We're going to take a quick break and we'll be right back with our special guest. Hi, I'm Dr. Ahmad Nooristani, a licensed physician that has been practicing medicine for the past 15 years.
Fact: millions of people suffer from low energy, joint discomfort, and overall poor health. People need healing from within their bodies. Balance 7 restores the body's natural defenses to improve joint discomfort, support brain health, and help sustain energy levels. See results in just 72 hours. Wake up and hit the ground running with Balance 7. Use code word B7 for your free bottle of My Smooth Skin.
I'm Dr. Nooristani. I endorse Balance 7. Welcome back. Cece, thank you so much for being with us today. I know you're super busy, so I appreciate you taking time today. So let's just dive into the topic, which is extremely important. But before we get into the detail, could you tell us what is gut health?
Absolutely, and thank you for having me. So the health of our gut microbiome really is the foundation of our health. We are made up of trillions of bacteria, and these bacteria actually dictate our immune function, our metabolism, our digestion, mental health, and hormone regulation. So if you're a numbers person like me, I found it interesting to learn that 70% of our immune cells are actually located in our gut, and 90% of the serotonin we produced is produced in our gut as well. So as you can see, our our gut health plays a vital role in our health and has the ability to impact many body systems.
Well, as we know, once again, in the last 10, maybe 15 years, gut health has become more important, and there's more studies, and the studies are continuing to evolve around this important topic and how to keep the gut healthy. In order for the gut to stay healthy, it should have a specific type of bacteria that helps in that process. So what does gut bacteria do? Because I mean, when we hear about bacteria, we think about infection and things that are really bad. So what does actually the gut bacteria do?
So our gut bacteria has many functions in our body. One of the main things it does is help with digestion. So it helps to break down those complex carbs and those fibers that our digestive enzymes weren't able to break down. And through a process of fermentation, it breaks it down into short chain fatty acids, which is really important for metabolism, inflammation, and nutrient absorption. And like I just mentioned, go ahead.
No, go ahead.
So when it comes to nutrient absorption, our gut bacteria helps with the B vitamins, many different vitamins and minerals, and that allows for proper immune function as well. Our bacteria does a great job at modulating our immune system. So it kind of teaches our immune system what things are pathogenic and what things are beneficial to our body. So not having a good balance of the beneficial good bacteria can allow those pathogens and those harmful bacteria to get into our system. Our bacteria is important for metabolism and weight regulation. So there's actually research that shows that a certain amount of bad bacteria is actually correlated with higher obesity rates in children. Our bacteria also helps with peristalsis. So peristalsis is basically just the movement of food through our GI tract. And again, depending on the balance of bacteria, it can either help with an increased or slow transit. When the transit is too slow, that can allow bad bacteria to overgrow, leading to many issues and symptoms.
We know we have seen a lot of patients in the hospital and also as an outpatient that comes in with different GI symptom or gastrointestinal symptom, from constipation to bloating to abdominal pain to chronic fatigue and all that. And we know a lot of it is related to gut health, not to mention mental health. There is a big component of that is regulated by gut health. We're going to take a quick break. When we come back, we're going to talk about the importance of gut health pertains to your mental health.
Dear Balance 7, I'm writing to say thank you for giving me my life back. I'm 62 years old, and a few months ago, insomnia devastated my life. I had no energy, my mind was in a fog, and my memory was going. I was afraid it was dementia. My doctor prescribed a sleep aid, but it had side effects, and the sleep was never restful. I even resorted to remedies like acupuncture and a hypnotist. None of it worked. That's when I saw an ad for Balance 7. It claimed results in as little as 3 days, and I thought, what do I have to lose? So I ordered a quart, an 11-day supply. For 3 days, I took 1 ounce 3 times a day as instructed. The taste was odd, but I gotta say, not bad. By day 4, I felt amazing. I ordered a gallon, and 4 weeks in, I'm sleeping again. My energy is up, the brain fog is gone, and my memory is back. Thank you, Balance 7.
Balance 7 hits your stomach acid, producing powerful alkalinity, unlocking your body's immune system, releasing it from its acidic prison, allowing it to do what it was designed to do, keep you healthy.
Balance 7, where your body wants to be.
Did you know acid buildup in your body is responsible for the majority of diseases? Discover how Balance 7 can help you maintain a healthy pH level. Visit balance7.com or call 1-800-793-9039. 1-800-793-9039.
Welcome back. Cece, we just talked about before break about mental health and its relation with the gut health. How can you tell us a little more about, can you explain those relations between gut and mental well-being?
Absolutely. So our gut health and our mental health greatly impact one another through communication pathways via neurotransmitter signaling. So there's something called the gut-brain axis, and that is where our gut and our brain communicate with each other. So many times people who experience IBD or inflammatory bowel disease tend to actually have more anxiety and depression and mental health issues. Similarly, those who struggle with anxiety and deal with chronic stress tend to have more bloating, digestive issues, and reduced immune function.
Now, so we know mental health is a huge issue, not only in this country, but around the world. Millions and millions of people suffer from anxiety and depression, and actually that's one of the top psychiatric disorders that have been diagnosed on on a daily basis, not just in the United States, but around the world. Now, gut health becomes so important from that standpoint, and we didn't pay much attention to it. Even now, as a physician, we don't actually really dial in educating people and making sure they have the right appropriate diet, especially dealing with those diseases like Crohn's disease, ulcerative colitis, or any other inflammatory syndromes, because the conversation is usually about how to manage the symptoms, right? If you have ulcerative colitis, here's a drug to take care of the symptoms. But we never deal with the underlying problem, and one of the major issues, obviously, gut health. So in order to promote your gut health, what is the best diet for any of us to adhere to or pay attention to, or try to get those things and incorporate them to our regular daily life?
So when it comes to gut health, there's not really a one size fits all for diet. A very general guideline I would say, though, for any client who is suffering with gut issues would to be follow a whole food based diet. And when I say whole food based, I basically just mean foods that come to as close to their natural form as possible. And this is both a combination of plant and animal foods. So fruits, vegetables, meats, nuts, seeds, things like that. We want to focus on those whole foods. We really want to try to limit our intake of ultra processed foods and highly processed foods. Fast food, junk food, alcohol is a big one, artificial colors, flavors, preservatives, because by decreasing the amount we intake of those, we're limiting our intake of inflammatory oils, added sugars, and like I said, artificial colors, preservatives. And those are the things that are really going to wreak havoc on our gut and be pro-inflammatory and cause a lot of downstream issues.
Now, over the last few years, I've seen a lot of patients when we have modified some of their diet, just with the help of nutritionists or being educated as a physician and making those specific recommendations. The transformation has been just fantastic to see this, how these patients respond, and the usage of different type of drugs, whether it's for inflammation, bloating, constipation, diarrhea, or any mental issue, has significantly improved just adopting some of the stuff that you mentioned. They're just those adaptation and diet. We're going to deep dive into the diet and type of diet a little bit later on, but just know that the balanced diet is extremely crucial to maintaining overall health, because too much of protein, too much of fat, too much of sugar, too little of sugar, too little of fat, all affect your gut health in a similar way. It decreases diversity and decreases population of the good gut bacteria. We're going to take a quick break. When we come back, we're going to have a lot more questions about some of the tips and tricks that you have that you're going to share with our audience. So we're going to take a quick break.
On November 21st, 2021, my family was told by my doctor to prepare for the worst. Like many, I ended up with pneumonia thanks to COVID, cryptogenic organizing pneumonia to be exact, a very rare lung disease. I suffered major weight loss, couldn't breathe on my own. I also had an underlying autoimmune, which caused major complications. My body was completely depleted. So there I was, 49 years old, not vaccinated, fighting for my life, loaded up with prednisone and on heart medication to keep my heart rate under control. After being hospitalized for about a month, I was transferred to an extended care rehab facility to learn to walk again. This is where I started taking Balance 7 loyally. I knew I had a long road ahead, and after everything I had gone through, what did I have to lose? I was still on oxygen and heart monitoring, Doctors told me that the pneumonia could affect me the rest of my life. At that time, I didn't think I would ever live a normal life again. Balance 7 immediately helped me gain my strength back. At just 100 pounds, I was exceeding my physical therapy goals. My energy and appetite increased. Somehow it helped my overall health. My boyfriend contracted COVID and has been sick recently, and I did not get sick either time. My doctors are blown away. I have made a full recovery. I will faithfully take my Balance 7 the rest of my life. Balance 7 is my blessing.
Welcome back. Cece, you have worked in the hospital, and I've been in the hospital for the last 15 to 16 years. Antibiotic is one of those challenging things that happens. Everybody needs it, and you have infection. There is no way around it. We have tried so hard to limit the usage of different antibiotics because we know the damages that it's going to cause as a side effect. Although majority of these antibiotics are needed to save lives, but at the same time, it's going to have deleterious effect on your gut health. Can you talk about antibiotic and how it affects gut health?
Yes. So, like you mentioned, antibiotics definitely have a place and are very beneficial at times. But while they are killing those bad bacteria that we don't want, they're also killing off that good bacteria. So completely wiping out all the bacteria in our system, again, is going to really cause havoc on our gut health. Now, in the cases where we do need antibiotics, I would say at least trying to maybe incorporate a probiotic with it to then help to repopulate that gut bacteria. And if you're the type of person who's constantly on constantly on antibiotics, you may want to ask yourself, why am I always sick? Let's take a deeper look into my gut health, at my immune function, and see, get to the root cause of why I'm always needing these antibiotics.
Yeah, so I mean, sometimes, as you say, it's unavoidable, right? People come in, they're extremely sick. One of the things we have talked in the hospitals or antibiotic stewardship, how we can kind of minimize the amount of antibiotic, the duration of antibiotic, and decrease the usage of broad spectrum antibiotic. Basically, those are antibiotics that we use to kill pretty much everything and anything we can think of. And then until we have cultures back to modify that. Despite that, the use of probiotics are not really prevalent. We recently started using that, so it's not an automatic. If you're using antibiotic, you got to be on probiotic, which I think that is something that that discussion need to be around those kind of treatment in order to promote the good bacteria and decrease the side effect. One of the main side effects that we see in inpatient is what's called a C. diff, the significant diarrhea that's caused by Clostridium difficile, which is another bacteria that overtakes your gut once the good bacteria that is there that's preventing it from wreaking havoc is taking over your gut and system, and obviously leads to significant infection in the gut, and that required by itself to be in a long-term antibiotic, and therefore is going to cause more havoc. So your system is extremely stressed. Now, we know we're getting close to the ending. So what are your top 5 tips for someone looking to improve their gut health?
I would say my top 5 tips would, number 1, limit your stress. So we don't really think about stress as affecting our gut health, but like I had mentioned before, our mental health and our gut health greatly impact one another. So by limiting your stress, getting out of that constant fight or flight mode allows our body to be in a more parasympathetic dominant state, allows our body to rest and digest our food, and allow our gut health to function as it should. The second thing I would say would be eating a more whole food based diet. So sticking to natural foods, limiting those highly processed foods, getting more microbiome diversity. So even though something may be healthy, if you're eating it every single day, you're lacking diversity in the diet. And our gut microbiome thrives off diversity. So a more diverse diet allows for a more diverse robust gut health. The third thing I would say would be increasing your pre and probiotics. So we already spoke about probiotics. Those are the live active bacteria. They can be found in supplement form as well as found in a lot of fermented foods. So fermented vegetables, kimchi, yogurt, kefir. So many different fermented things have those good live bacteria, where prebiotics are actually the food for that bacteria. Prebiotics are found in a lot of different fibrous foods. So, things like bananas, oats, actually chocolate is another form of prebiotic fiber, beans. So getting a lot of that good prebiotic fiber helps to feed that live gut bacteria. So they have a symbiotic relationship, and we need both for a thriving gut. The fourth thing I would say is chewing your food. Again, something that's overlooked, and we don't really think about that. But the more you chew your food, it actually increases the surface area of that food itself, allowing those digestive enzymes and that saliva to really break down that food. So it's less work on our gut to break it down. And the fifth thing I would say is regular movement or exercise. So any form of exercise or movement has been shown to increase the number of beneficial bacteria in our gut and increase the microbiome diversity, both of which are really important factors in a healthy, thriving gut.
Cece, thank you so much for all these wonderful tips and tricks. I'm hoping that our audience take advantage of this and pay a close attention to their gut health. We're going to take a quick break. We'll be right back.
I was diagnosed with incurable lung cancer, stage 4, and given 2 years to live. I had one spot of cancer over here, about 50-cent size, and then big one over here, and my lungs were filling up and I had to get drained every 9 days. Within 3 months, 3 chemo treatments. I haven't had to be drained in 2 months now. This cancer is gone, and this one over here was about halfway, and it's got a different shape and smaller than what it was. So as far as I'm concerned, Balance 7's done a wonderful job along with the chemo. My hair's growing back. The doctor at the hospital was amazed at how much of the cancer had shrunk so fast. And that's when I told him I was taking the Balance 7, and he was really surprised about it. He just told me, don't change anything I'm doing, because whatever it is, it's working. I got a good appetite. Cancer can't live in a body with alkaline in it. So I just followed what Al said to do with it. I definitely recommend it to anybody, whether it's cancer, Alzheimer's, and heartburn. It's not just for cancer. I mean, you got any aches or ailments? That's what I'd suggest trying. Yeah, so if anybody's going through chemo and having a bad time with everything, and especially the side effects or something, you should give it a try, because it's definitely helped me. It's definitely a miracle cure for me. Never good to hear that you only have a couple of years to go, but like I say, I added more on to mine, I know, and I'll keep going.
Welcome back. The typical Western diet, high in processed food and sugar, is associated with an imbalanced gut microbiome. Lifestyle factors like stress, sleep, physical activity can influence your gut health. Chronic stress can negatively impact the diversity of your gut microbiome, and small changes in your diet could have a significant impact in your overall health. In a society where different types of diets are invented on a regular interval, we want to highlight a few of them and their effect on your gut health. For example, ketogenic diet, very popular nowadays. It's a diet high in fat, high in protein, but low in carbohydrate diet. Now, restricting plant-based carbohydrate can have a considerable effect on your gut microbiome, given that the fiber and prebiotics that are required for bacterial diversity. Now, this reduction in the fiber contribute also to constipation as a common side effect. The next one is veganism. So basically, veganism is the practice of abstaining from the use of any kind of animal product. The good news is that a vegan diet tends to be higher in prebiotic, the fuel used by the good bacteria in the gut. Now, prebiotics support the bacteria that are already living in the digestive tract. You'll find prebiotic in plants food like apples, onions, garlic, leeks, beans, and grains, etc. The next section of type of diets is low carb diet. Low carb diets restrict carbohydrate consumption relative to average diet. Now, food high in carbohydrates are limited and replaced with food containing higher percentage of fat and protein, so almost like keto diet. Now, some studies have shown that low carb diet reduces total bacterial level in addition to reducing bacterial diversity. Now, those reduction in diversity and type and amount of bacteria results in a less beneficial anti-inflammatory species, while other less desirable probiotic species increase. So not only decreases the good bacteria in your gut, but it also increases the bad one. So that relates to multitude of disease. How about intermittent fasting? I know this is the newest trend now. Intermittent fasting is basically restricting feeding on an 8-hour window, 16-hour window, or some people even go to 24 to multi-day fasting. Now, some of the studies have shown that it improves the gut barrier function, increases microbial diversity, enhances antioxidative microbial pathway, and even reverses intestinal inflammation. In a healthy human, a high fat or high protein and or too low fat diet all lead to reduced gut microbiota diversity as quickly as one day. Lack of fiber can have a long-lasting detrimental effect over a generation of the gut microbial ecology. Now, making better food choices involves eating a balanced diet that is rich in fruits and vegetables. These foods provide the fiber needed to build good bacteria and guard gut health. In general, choosing whole food over processed food will promote healthy digestion. The gut is a powerful player in your overall health. It's important for you to make informed dietary choices. Until next time, stay well with a healthy choice.
Tune in to Health Check with Dr. Nooristani weekly to gain insights that can transform your health journey. Let's build a healthier, happier community together. Get ready to be informed, inspired, and tune in with your health. See you on the next episode of Health Check with Dr. Nooristani. The opinions and statements made by guests on this show are their own. Noble Productions does not constitute an endorsement or validation of what is discussed.